Good afternoon, everyone. I'd like to call the Hillsborough County Emergency Policy Group meeting to order. Hope everyone had a great weekend. Will the clerk please call the roll?
Miller?
Here.
Overman? Overman? Merman?
Here.
Cronister?
Lazinski for Cronister.
Castor?
John Bennett sitting in for Mayor Castor.
Ross?
Here.
Lott?
Kilton for Lott.
Snively?
Here.
Wise?
Here.
Quorum.
Thank you. We'll now move into public comment. The Emergency Policy Group, EPG, welcomes comments from citizens about any issue or concern. Your opinions are valued in terms of providing input to the EPG members. However, it is requested at the same time you address the EPG that comments are not directed personally against an EPG member, a staff member, or a presenter, but rather directed at the issues. This provides a mutual respect between the EPG members and the public. 20 minutes has been set aside for public comment. Each speaker will have 2 minutes. Our first speaker is Jason Kimball.
Hey guys, so I sent over a link when I submitted my public comment to a randomized controlled trial on cloth masks. It's very important. I only recently found out about it. But according to that study, which is really the only valid study, I mean, that's the standard. That's the standard that the FDA uses to approve drugs and to approve medical devices. It's the accepted scientific standard. According to that study, cloth masks increase the risk of infection. So, I mean, this is really terrible. This is a worst case scenario here. We have to take action immediately today. We cannot renew the mandatory mask order. There's no way that with the emergence of that data that we can renew the order. And I mean, scientifically, the mask pushers really need to present valid evidence that masks are effective at all. They haven't done that. It's been weeks upon weeks upon weeks. There's really no excuse at this point. So I really hope that we can fix, the situation that we put our county in and that we put ourselves in. And I just am really concerned about the situation that Hillsborough County is in legally, with the emergence of this data. I don't want to see, crazy lawsuits filed. I mean, I think that it's just a huge mess. So I really hope that you guys give this serious consideration. And also, I think I'm aware that there's a motion to dismiss the lawsuit against the EPG in Hillsborough County. I think that's outrageous. That motion needs to be withdrawn. Ms. Beck needs to go to the court, withdraw that motion. This needs judicial review. There's no reason to try to deny judicial review to this order. It's many people feel it's unconstitutional. I've heard from certain members that there's been polls and over 80% of people support it, but I don't think.
Thank you, sir.
Thank you.
Your time is up. Thank you. Our next speaker is Kimberly Pullen.
Thank you, Mr. Chair. And thank you to the members of the EPG who have continued to protect the citizens of Hillsborough County by continuing the mandatory mask ordinance. As we close in on the start of the school year, our concern is for our students, teachers, staff, and families of our county. While I understand this body does not have authority over the school board, you do have an obligation to keep our entire community safe. And these two topics are not exclusive to one another. This group has been led to believe that half of the parents and teachers in our county want to return to brick and mortar classrooms, and that there were no cases of COVID that caused school closures over the summer. Both of these statements are lies. As of July 23rd, almost 62,000 students and 3,277 teachers had not even responded to the declaration of intent surveys sent by the school board. This is 32% of our students and 22% of our teachers. Over the summer, with minimal staff and students on site, there were 206 positive COVID cases that cause closures within our county. Teachers and students in our county are living with and caring for elderly family members, infants, and otherwise compromised or high-risk individuals within their homes. Family transmission is always the highest rate of transmission throughout our community and our country. And rightfully so, our families with school-age students are terrified to the start of the school year. As you continue your discussions on these topics, mandatory mask ordinances, and things of that sort, I simply ask that you keep all of these things in mind as you make decisions for our community in the coming weeks. Thank you very much.
Our last speaker is Mike Mosen.
Good afternoon, EPG members. Thank you, Chairman Miller. I just wanted to take my time to just thank everyone just for the hard work that they're doing and just everything that you guys have done. I know there's a lot of bickering, and I know at times that it seems like things can be very crazy all over the place, but thank you guys. I'm looking at the data every day, and it seems like we are finally seeing things trend in our direction. One thing that I ask is that we do not let off the gas and that we continue to press with the mask mandate, and we look at restrictions if we see outbreaks in certain zip codes and areas. The Center for Public Integrity actually released the coronavirus task force that the White House has set up, and their data on a state-by-state analysis of where the outbreaks are happening. Now, our county was flagged to have more restrictions to move into a phase one. Since that has come out about 11 days ago, we have seen an data that has gone to our direction where infection rates and hospitalizations and positivity rate has gone down. So I just ask that the EPG just put aside political beliefs and really focus on the health of the people and really focus on making sure that we see the end of 2020 with many alive and healthy citizens. Thank you so much.
Okay, thank you. That ends our public comment section of the agenda. We now move into emergency management update. Mr. Tim Dudley.
Good afternoon.
Good afternoon.
We continue to move forward with testing. Last week, teams were able to test 7,926 citizens here in Hillsborough County. We have 75,812 total tested at our community collection sites. This week, teams will focus on the 8,611 appointments that we have scheduled for this week. Logistics, we have 34 guests checked into the isolation site. We have no PPE or testing kit shortages at this time. We will continue to adjust testing capacity in response to increased testing demand and as PPE supplies and staffing permits. This concludes my update. Any questions?
Okay, thank you, Mr. Dudley. And I see no questions. Thank you very much.
Thank you.
Public health update. Dr. Holt.
Yes, this is Dr. Doug Holt, Florida Department of Health, Hillsborough County. I'll be presenting the most recent epidemiological and hospital data. As usual, I'll provide some high-level observations about the trends. I'm also going to do some comparisons about where we are to other counties in the state, cities across the country, and suggest or outline some goals for us. A quick update from the news, though. The vaccine effort is very significantly entering what's called a phase 3. We're beginning clinical trials to see how effective they are. This is very, very remarkable when you think what the science has done in less than 6 months. Normally, this would take many years. Point of fact, historically, the fastest vaccine that was ever developed took 4 years, and that was for months. Again, this is a cause for hope, but we'll have to wait for the results. Another end of the spectrum, the CDC did do a survey and found about a third of the people that were not hospitalized had persistent syndromes or symptoms such as fatigue, cough. This is significantly higher than influenza, which about 95%, were fully recovered at 2 weeks. And last, I'd make a note, the Surgeon General just issued a public health advisory. This is not an executive order, but he has issued a recommendation that the number of people gathering should be decreased from 50 to 10. With that, I'd like to begin the presentation. Mr. Wagner, can you start with page 2, please, or slide 2?
Go ahead, sir.
Okay, we added 406 cases today, so our total is now 27,483. The total number of cases that have been reported in the last 7 days have increased the total amount by 14%. But again, this is showing a slowing of that increase over time. To date, almost 2%, 1.9% of our entire population has been tested positive. We do know that the actual numbers are a little higher. We don't know by how much of this. We've had 299 reported deaths. That's 0.021% of the entire population that have died from COVID. The estimated number of recovered, remember these are those that were infected, had a positive test 30 days ago and have not been reported as dying, has increased 2,000 since we reported on Thursday. This is continue to show a large increase daily as the number of new cases that we were seeing in June were so large. And as we pass that month, our fatality rate, the number of people who are infected with COVID in the county, is low, around 1%, which is, again, significantly below national and even the state average. Let's look at our trajectories. Our rolling 14-day average, daily average, is 566. This is a decrease of 15% from the prior 14 days. Just 1 week ago, we reported this number at 670. So the rate of decrease is encouraging. Also looking at the 7-day average, we're down to 482, which is a 26% decrease from the prior 7 days. You'll note that I have a reference to the rate of 241 per 100,000 for the last 7 days. This is the number of people over 7 days that live in the county or among our county population that have been infected or on a per capita basis. This does allow us to compare where we are compared where we are to the state, other communities. But it also gives us some goals that are accepted throughout the world and the nation as we move from our current high level of community-based transition and want to achieve goals where we can contain or even suppress this virus. But I'll come back to that. Our testing, you'll notice that the arrow is now red, but that's only because we have changed our goal. Originally, Dean Lockwood set a goal that was 2,250 cases or tests a day. That was in April. That reflected the number that was needed in that early mitigation just to kind of know the trends of the virus. This new target is associated with what we want to be able to do so people can get tested timely, results come back timely, and people can begin to isolate quicker, and the contact tracing is maximize their effectiveness. If you recall, with the testing, when Dean Lockwood initially set that goal in April of 2,250, it seemed unrealistic, but we quickly have surpassed that. And even with this new high level, we are 36 below that target. And as mentioned last week, and with Mr. Dudley's announcements about the new testing access, and also some new testing like rapid antigen, I'm confident we will achieve this. Our 14-day positivity rate is now at 13.22%. Thursday, I reported at 15. That's about a 13% decrease. Looking at my own calculations for the 7-day, the rate is 11% or 10.8. We had a range of 8, as low as 8 to a high of 13. So we are nearing our first goal, which is to achieve less than 10%, and we will move toward our ultimate goal, which would be less than 5% while we are doing this large number of 6,000 or so tests a day. To summarize, the level of virus in our activity or in our community base is still widespread and high, but is trending downward. We are heading in the right direction, continue to keep up our social distancing and the 3 C's of facial covering, avoiding crowds, and avoiding closed spaces. Going back to that 241 per 100,000, the state of Florida is at 344, so we're below the state average. That's predominantly because of Miami-Dade being an extreme outlier, close to 750 per 100. Within our Tampa Bay, we are below Manatee, which is around 320, but we are above Pinellas, which is 170. We're doing better than all the other metros in the state by this number: Broward, Duval, Palm Beach, and Orange. Throughout the nation, we are below Phoenix and New Orleans, but we are higher than Houston and Los Angeles. So if we think about the goal using this number, where we are now, but more importantly, where we want to be, looking for a stepwise decrease. I'd like to see us get down to first 175 per 100,000. Would no longer be in what's classified as a hotspot area. We can get closer to 100 per 100. We get into another level, which is a moderate level of community-based. And at 70 per 100, we would enter the lower range of community-based. And our ultimate goal is to get less than 5. It sounds very unrealistic, but that's where we were in the 1st of May. And that's also where both New York State and New York City are right now. So again, working together, we can achieve this goal while avoiding taking a step back and certainly more aggressive. It definitely also helps us as we look ahead to the challenging we have with school reopenings and other efforts to getting back to normal. Looking at our hospitalizations, again, Dr. Chang reminds me to remind us all that we're using our Tampa General Collaborative data that is delayed and somewhat incomplete, as not all hospitals report. I do continue to reference the ACA data, but most importantly, and Dr. Chang, again, we talk about this, the trends may be are similar. So the decreases that we'll be talking about by his data and ACA are similar. So looking at the hospital collaboratives here in the county, or Dr. Chang's, our 7-day census average is 393. That's a 22% decrease in the past 7 days. ACA reports that number at 604, but a similar decrease. What's really remarkable, I looked at the last 4 days, hospitals collectively discharged 320 patients while admitting 189. So the cumulative net was 131 hospitalized patients were discharged or reduced. And this really makes sense because we're admitting less, and the discharges are from that earlier surge a week or two, and they're now being discharged. Hospital bed occupancy for the hospital collaborative is 64%. That's significantly lower than the ACA of 87% of total beds. But again, both of them have a steady or flat, not much. It hasn't really changed either way. Same thing with the ICU beds, a little more comparability 81% are occupied per the Tampa Journal collaborative effort, and 87% on the ACA. Admission date average is 40 versus 55 for the ACA, but both of those it decreased almost 20%. Again, I'll keep mentioning that we are seeing admissions and transfers from long-term care facilities, both to our hospital, university, village, and others, which is somewhat concerning, and we continue to watch that very closely. Finally, our deaths, which is the most lagging indicator, is now at 299, but that is a flat, has not changed in the prior 7-day period. I'll ask Mr. Wagner to now go through the dashboard, please.
Sure. Thank you, Dr. Holt. Kevin Wagner, Business Analyst, Healthcare Services Department. Again, presenting the publicly available dashboard through the Hillsborough County website. Speaking on the first row, again, 27,000 cases. There was an additional 400 today that will be updated on the dashboard when the push occurs. The overall trend of the dashboard, green, positive, red are areas of concern, are showing mostly greens on all items. The 7-day row 2, the 7-day case percentage change is decreasing somewhat at 25%. The 14-day case percentage decrease is a 14% decrease. So those items are moving in the right positive direction. Row 3 is the hospital data that Dr. Holt just referenced, which again is the TGH source, and we are evaluating the source documents on this to move to potentially ACA when available. Those are trending downward as well from an occupancy standpoint and an admission standpoint. The next slide regarding to overall cases, I'll speak to the bottom graph of the lines. That represents the 7-day and 14-day rolling averages that we just talked about. And as shown over the past week to 10 days, we've seen a flattening and a decrease. When the last 4 or probably 5 of the last 7 days have been under 500 cases with a few uptakes, but overall the cases have been reported under 500. So that is trending in the right direction. The overall average, as we talked about, the 7-day is 482 and the 14-day was 566, trending in the direction that we're hoping for. With regard to the overall testing, again, Dr. Holt has increased the testing range from the Dr. Lockwood of 2250 a day to nearly 7,000 a day. So again, that benchmark will change as a new goal, but overall the testing results have been strong in the community. And as Dr. Holt mentioned, the 14-day positive trend is currently around 13.2%. With regard to hospitalization data, I'll speak to the top row in the middle box. The flu-like illness by the ED visits as reported by FDOH has seen a significant decrease of 666 starting the week of July 19th. Again, that was a decrease from the previous week of nearly half. So presenting at the ED department of COVID-like illness is showing a decrease. And again, this is lagging data, but the trend is in a positive direction. Box 2 of the first row is the hospitalizations by age group. And again, as we've talked about, the hospitalizations are over in the 50 plus side, 50, 60, 70, 80-year-olds respectively. But overall, the trend in the hospitalizations is, as we hope, have peaked and starting to flat or decrease as shown out here. I'll stop there. Thank you.
Thank you, Dr. Holt. And Mr. Wagner, we have some hands up. Commissioner Overman, you're recognized for a question.
Thank you, Chair. I appreciate that. Thank you for all your data. That was very, very helpful. And it looks as though, although it's not easy to tell on the charts, it looks as though our mask order is making a significant difference, and I'm glad to see that. Mr. Wagner, would it be possible to show on your slide 6, I believe, it would be helpful, where phase 1, phase 2, and the mask orders occurred. As you can see, the phase 1 rolled out, I believe, on April 29th. And our numbers were going down. We had a really high number back in March when we first, and then we put the safer in home order in place. And then we had the phase 1 as the beginning phases of people being out of their homes. Phase 2 rolled out, I believe, June 3rd. And you can see our numbers were looking really good through May. And then June, they don't look so good. And then when we went to phase 2, the lag time for response is evident. And then we hit a peak and put in the order in June 22nd for the mask, and then things started to get better. But again, it looks as though there's a 14, is there about a 10 to 14 day delay before we start to see the results of certain actions based on your data?
Based upon the data, the phase 2 was June 22nd. Not slide 6 would not be best, but slide 5 would be best. So June 22nd isn't even represented on this slide on the bottom left-hand side. But again, that's when the phase started and your trend started decreasing based upon all administrative actions.
Not based on the April 29th phase 1 reopening, right? It's not showing where we've been. It's showing where we are now, which is looking like it's getting better, but it's still pretty flat. And it's very clear from the prior slide that the numbers start to look much better sometime in mid-July. And I can't see the date, but we went from 17.57 to, I can't tell, 13.22. A 5% move matters because of good things that our citizens are doing to protect themselves and others.
Sure, of course, yes, Commissioner.
Okay, so if you could show us those benchmark dates on either this chart or the other with a long enough timeline, that would really be helpful for people to see that the things that they're doing, the mask wearing that they're doing, and the efforts that they're putting into place are making a difference, because we're not going to get to 5% before the schools open if people don't recognize what they're doing is working, in my opinion.
Or we'll be happy to add that respectfully, Commissioner.
Thank you so much. I appreciate it. And
Mayor Ross, you recognize.
Thank you, Chair Miller. Dr. Holt, I have a question. The testing goal. I understand why more testing is better, but can you speak to the significance of the number of 6,750? Is there a significance to that number, or is it just a larger number? Or can you talk about that, please?
No, yes, sir. That's very excellent. The study that Dr. Lockwood referenced had a range. The lowest range was the 2,250, and that was in when you entered sort of the phase of we need, where we were at the time with actually doing less than 1,000 a day. And the higher number is so that the goal is that people who want to get tested can get tested within 24 or at the longest 48 hours of the onset of symptoms or when a known exposure. And it takes, and then the results come back within 48 to 72 hours. The number, the 6,600, that number is that will allow that amount of the public to be tested as part of our containment and suppression effort. If we don't have this level of testing, then our results come back too late for us to actually make a difference in prompt isolation and contact investigation. I'll stop there.
Okay, thank you, Doctor.
Okay, Commissioner Merman, you recognize.
Thank you very much. Just a quick question. I wanted to ask Dr. Holt, I'm still hearing from a lot of constituents, especially those that have been exposed, that are getting very long, it's taking a long time to get their test results, and I'm talking over 10 days. Is there anything we can do to help speed up the test results? Because it does create anxiety. People are having to, again, redo their workloads and, to try and isolate themselves. But I'm concerned for a lot of people out there that have been exposed and, they just can't get the results.
Yes, ma'am. This is actually a nationwide issue. I think it's been reported that both LabCorp and announced are essentially backlogged, and that they now are approaching 7 days more on their average. And my experience has been when they say 7, that's usually more. But and we're actually seeing that in our reports of the results coming back. And that's really happened in the last 1 to 2 weeks. The biggest change that we have done locally, and again, I'll reemphasize the success that Mr. Dudley, Mr. Early, and others has made the availability of appointments has reduced. And that does at least reduce the amount of time that it takes for us to get the results back. But the lab corporations, the problems have to do with actually the machines that are running 24/7. There's not enough of them, and they're ordering those. And then there's something with the reagents. And you may have heard about or read about pooled testing, is where you take 4 or 5 and you run it in one batch. So you could theoretically run 4 to 5 times as many tests as you could just with the same run. We aren't eligible really for that in our area until we get our percent positivity down significantally. So long answer, but short is that the labs are just overwhelmed, and there's really nothing locally that we can do to address that right now. I'll stop there.
Okay, thank you for the information.
Okay, Dr. Holt and Mr. Wagner, thank you very much. Thank you very much. County Attorney update, Ms. Beck.
Yes, good afternoon, Chair Miller and EPG board members. Christine Beck, County Attorney. We have provided a draft order in your backup extending the face covering order for an additional 7 days. And Mr. Chair, it would be appropriate to entertain a motion with regard to that order.
Thank you. What's your pleasure? What's your pleasure?
So move.
What's, pardon me?
I would like to make a motion to renew the mask order.
There's a motion by Commissioner Overman. Is there a second? Is there a second? I'll pass the gavel to Commissioner Merman, and I'll second the motion.
Thank you.
I will second if you don't want to do that.
Thank you.
No, I second. Just carry the motion.
Okay.
Okay.
So we have a motion by
No,
Commissioner.
not you. Not Commissioner Overman. Not you. You made the motion. You cannot carry it. I second and pass the gavel to Commissioner Merman. Commissioner Merman must carry the motion.
Thank you.
Okay, so we do have a motion by Commissioner Overman, second by Commissioner Miller. Are there any questions, or is there anybody's hands raised, Commissioner Miller, on the motion?
I don't see any hands raised, Commissioner Merman.
Okay, please call the roll for the vote.
Miller? Chairman Miller?
He may be frozen.
Yes.
Okay. Overman?
Yes.
Merman?
Yes.
Lazinski?
No.
Bennett?
Yes.
Ross,
Yes.
Kilton,
No.
Snively.
No.
Motion carried 5-3 with Lizinski, Bennett, and Kilton voting no.
Okay, we're now moving to EPG discussion. Is there anything for that anyone wants to bring forth today?
Chairman,
Yes.
it's John Bennett. I believe the roll call recap had me voting no, and I voted
I'm
yes.
sorry, Mr. Bennett. I meant Lizinski, Kilton, and Snively voted no.
Okay.
Bennett voted
All right.
yes.
Thank you for that heads up.
I apologize
Thank
for
you,
that.
Mr. Bennett. Okay, no problem. Is anything the discussion that anyone would like to bring forth? Any discussion items? Any discussion items?
Yes, I'd like to ask one question for our Dr. Holt. Can we get an update on the best practices for contact tracing that you have adopted so far? And have we considered localized contact tracing for our senior communities and our educational professionals as we approach school possibly opening in a month or so?
Yes, ma'am. I'm happy to provide that update. We've actually been working to provide an update of all elements of our moving forward between our testing, our contact tracing, and our hospital support on Thursday, if that would be appropriate.
Thank you. That'll be fine. Thank you.
Ms. Snively, you recognize.
Thank you, Mr. Chair. Just wanted to respond with regard to some of the comments that were made in the public comment section, but also get back to some of the questions I think Commissioner Overman had for the school district. And this is really to also respond to a recent news article that came out with regard to cases in the school district. And so I met with the superintendent who gave me some additional information with regard to the positive cases. As you might recall, last meeting, the information that I did have was that no HCPS programs had been shut down over the summer due to COVID. That is still the case. However, we have had, as of Thursday last week, 206 positive COVID cases reported to us over since March. 201 have been staff members and 5 have been students. Our district does have 235 traditional schools and a number of other sites, several other sites. In fact, we have the most sites of anyone in the county that our employees report to and work over the summer. The majority of cases are from individuals who've come to work sick instead of reporting properly and not following the protocol, unfortunately. In each case, our district employs contact tracing to identify any other employees that may have been exposed to the employee that reported being positive. Our teams disinfect all the areas where affected employees work using approved chemicals and disinfectants to deep clean the area. And as soon as that's finished, workers are allowed to return back to that area once it's been sanitized. This type of cleaning includes anything from one office space to a wing of a building where the individual may have worked. No school has been closed to any positive COVID cases this summer. And in each case, we've communicated with any employee that may have been impacted by that particular positive case. And just to always put things in perspective, and I understand, I'm not trying to diminish the number of cases, but I do like to put it in perspective. Since March to now, there have been anywhere from 215,000 students to 25,000 employees. And so not necessarily throughout the summer, there've been a smaller amount of employees and students on certain sites, but thousands of employees still working over the summer. And so although 206 cases sounds like a lot of cases in perspective, it is about the same rate that that is currently that Dr. Holt currently talked about per 100,000 in our school district. So that is taken into consideration as the school district continues to evaluate the reopening of schools. The district school board did vote for all three plans, to approve all three plans, which include brick and mortar, e-learning, and virtual school. Based on the feedback that we've received from our parents and our employees, we continue to evaluate that, and we have another meeting scheduled for next week on Thursday, August the 6th, to get some expert feedback and input and opinion from local medical professionals and local public health officials to continue to monitor the rates of COVID before the board makes a final decision. But we're planning for the most complex plan, which would include all three options. It's easier to plan for all of that and pull back if we have to, rather than having to only plan for two options and then move to three options at the last minute. So that's kind of where we are as a school district, in case that helps with answer some of your constituent questions. And we'll continue to discuss that as a board. We did move the start date of school back from August the 10th to August the 24th. So that was definitely approved by the school board. And like I said, we continue to monitor the COVID situation in consideration for reopening the schools. Thank you for allowing me to give that information to this group.
Ms. Snively, let me ask you maybe a couple of questions.
Yes, sir.
So the school board voted last week to do what? Are they voted on to utilize all three plans? Are they just voted to open all the schools bricks and mortar? What exactly did you all vote on? I know the vote was 5-2.
It was a 5-2 vote to approve the superintendent's reopening plan, which includes all three options: brick and mortar, e-learning, and virtual school.
If you're going to open the schools, how are you going to guarantee that there is no outbreak of coronavirus within the school district? Is there anything that you all are doing that adheres to the CDC plans on infectious disease? Doctors are from epidemiologists to make sure that this disease does not spread within the school system?
According to the superintendent's plan, we will follow the CDC guidelines as closely as possible, but there's no absolute guarantee that no one would contract COVID in the school district, just like there's no guarantee that someone wouldn't contract a cold or flu or any other illness that is contagious. And so, to expect 100% guarantee that no one would ever be sick that is just not a feasible expectation. Otherwise, we'll never go back to school. Children would never go back to school forever. So we're going to have to get to a place where there is an acceptable rate. I don't know what that answer is. I'm hoping that the public officials and the medical experts that we rely on would give us some type of positivity rate, whether it's 5 per 100,000, as mentioned by Dr. Holt, or 70 per 100,000, whatever that number is. We're going to need to be able to have some type of number to work with, some type of metric to work with, in order to be able to safely reopen the schools.
Will you all be allowing either faculty or staff that could very well be immunocompromised to, say, for instance, if they want to wear a scrub or something like that on a daily basis to protect themselves? I know you're talking about masks. Are you all going to allow that to happen? To say, if a faculty member or a staff member wants to wear a scrub, are you allowing that?
I don't see why we would not allow any protective equipment to be worn by a teacher. I can check with the superintendent, but not that I'm aware of. There's nothing that would stop a teacher or staff member on a school site from wearing a mask or wearing a clear face covering or wearing, protective equipment if they are immunocompromised, or there are options. I know the superintendent is trying to give teachers who have health issues or are compromised with their immune systems the option of e-learning or virtual learning, first come, first served basis, so that they are less exposed if they do, so that if they choose not to do brick and mortar.
And I asked that question, Ms. Snively, because the mere fact I heard today, and I heard it this weekend, that the superintendent has said that that would not be allowed, or if a teacher or a faculty member who has an office who was willing to buy their own shield and install their own shield to protect them if they're compromised, would not allow that to happen. And I'm saying, why is that the case? And we should be doing everything possible if we're going to open up bricks and mortar to allow faculty, staff, and whoever that may be immunocompromised to do certain things to protect themselves. But I'm hearing that the superintendent said no. So that's why I asked that question. All of us in the county commission have been getting email after email after email after email about the opening of schools, and we try, we start off trying to email them back and tell them we don't have that, that's not our jurisdiction, but they continuously, then they hear that the superintendent said, no, if you're immunocompromised, you cannot wear a scrub, or you cannot put a shield up if you're in an office by yourself, whatever the case may be, because that's not within the guidelines. You get a little concerned as about what's going on here. So that's why I asked those questions. And I must tell you, Ms. Dudley, I am truly concerned about opening up schools. I really am.
Well, I appreciate that, and I appreciate those are great questions, and I'll try to come back next week with some clarification on that. I do know with regard to plexiglass and some of the other tools that that teachers were asking to put up in their classroom, I think that as far as the teachers who have compromised immune systems, that's certainly one specific situation. But I do know there were some teachers that were wanting to put up separators between their students. And if they do that in one class, we would have to do that in every single class. And I know there are some teachers that have offered to pay for that themselves out of pocket. However, again, if the one teacher is doing it in one class, that would have to be replicated for the entire school district. We can't only have one teacher putting up plexiglass separators between their students. That would have to be done. And unfortunately, due to the district's financial constraints, that may not be as a possibility. So, but I'll come back with some additional information on Thursday with regard to PPE and what would be authorized. However, I understand your concerns, and we'll get you some more information on that.
Thank you. Commissioner Overman, you're recognized.
Thank you. And actually, thank you, Ms. Snively, for your report. I want to make sure I heard you correctly, because I want to make sure I'm not misunderstanding what I think I understood you to say. So over the summer, you had 206 cases. For how many adults and children that were actually on campus on average over the summer versus the 200,000+ children you have now, and being the largest employer in Hillsborough County, I would imagine they have a significant staff level when it comes to both teachers, cafeteria workers, janitorial staff, as well as your bus drivers. I mean, that's a large number of people. I'm to understand that you didn't have all those people working over the summer. Is that correct?
Yes, through the chair, that is correct. We did not have full staff over the summer, but that number was from March. From what I was informed by the superintendent's office, that wasn't just summer. So that, was from an earlier point in the year. However, you're correct that not the full staff has been on campuses since March, and obviously not the full student population. So I will get the number of, I will Thursday bring back the number of staff and the number of students that were included in this measurement of information.
That'd be very helpful. Thank you very much. And did you offer bus service to school locations over the summer?
We did offer bus service. We were also very involved in the grab and go with our bus service as well, the grab and go meals and the electronic devices, the distribution of electronic devices. And so there was a lot of interaction over the spring and the summer, handing out meals and handing out electronic devices. And so several of our staff members were doing that over the summer and the break, as well as utilizing our transportation services to get those meals and get those electronic devices out to students. So there was quite a bit of exposure there as well. But I'll get some more details for you for Thursday on the number of staff and the number of students that 206 includes.
Yeah, it was great that the school district was able to provide that service to distributing food over the summer. And that was well needed and appreciated by the community. But it is my understanding there were no kids on buses over the summer, correct?
Correct. There were no students on buses over the summer.
Right. I'm sorry, students. Okay, terrific, great. Because that is, I'm curious about how you're going to manage the distancing associated with bus service to schools, even if you have only half the kids going to brick and mortars.
And that is a challenge. That is one place where we are not going to be able to guarantee that CDC guidelines could be followed on a school bus. Unfortunately, there's just not enough space on a school bus in order to make that happen. But that is one reason the superintendent is making the mask and facial coverings mandatory for students, because if you cannot maintain social distancing, then you should be wearing a mask on your face.
Okay, and are you going to be providing monitors on the buses to make sure that the kids are actually doing that? Because clearly the bus driver can't do that.
That is a great question. I don't know if there will be any additional adults monitoring that on the school bus. Many school bus drivers do have assistants that ride on the buses with them. I don't know if 100% of our bus drivers will have assistants on each school bus, but I'll pose that question as well to see how that will be managed on school buses.
Excellent.
Okay, thank you.
Thank you very much for your feedback. I appreciate it.
My pleasure.
Okay, is there anything else we need to bring forth today? Anything further? Seeing none, we'll be back together this coming Thursday at 1:30. Seeing no further discussion, we'll adjourn. Have a great day.
Great. Have a good one. Thank you.